Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Thiozolidinediones. Thiozolidinediones include the drugs like we have troglitazone, then we have pioglitazone, then rosiglitazone. So these are the thiozolidinediones. Thiozolidinediones include troglitazone, pioglitazone, and rosiglitazone. These are also called as insulin sensitizers. So what are the mechanism of action of thiozolidinediones? These mechanism of action are these are PPAR gamma agonists. Thus, they are PPAR gamma agonists, and thus they increase the transcription of certain factors. They increase the transcription of adiponectin. They will also increase the transcription of GLUT4 receptors, and also they increase the transcription of triglyceride receptors, and thus they act in insulin responsiveness. So they will help in insulin responsiveness or response of insulin to the tissues, like the insulin responsiveness in fat and muscles also was modified by this thiazolidinediones. So they have no effect on insulin action. So because they have no effect on insulin action, so they cause mild or they can cause no hypoglycemia has side effect, but they are associated, they can reduce HbA1c, which is the beneficial effect. Then pharmacokinetics of thiazolidinediones. In the pharmacokinetics of thiazolidinediones, first we see troglitazone. The drug troglitazone. This can cause hepatotoxicity. Because this troglitazone causes hepatotoxicity, it is banned. Then we have rosiglitazone. Rosiglitazone can cause can increase the risk of MI. Because rosiglitazone increases the risk of MI, it is also banned. And then we have pioglitazone. Pioglitazone is only approved drug, but it has a black box warning. Why? Because this pioglitazone can cause, it has a black box warning. Why? Because this pioglitazone can result in bladder carcinoma risk. Right. The uses of this thiazolidinediones are, it is used in type 2 diabetes mellitus with insulin resistance. Then side effects of thiazolidinediones. The side effects are, it can cause edema due to expansion of the plasma volume. So this, because it causes edema due to expansion of what plasma volume, it is never, so because of this it is never used with congestive heart failure, because in congestive heart failure already there is plasma volume is more, and it can cause weight gain, it can cause fractures and anemia.
thank you and thank you for watching.